When my oncologist talked to me about the treatment plan, he told me that I had a 5% chance of survival. And I asked him not to speak that garbage over my life because I'm going to not only survive this, but I'm going to kick cancer's ass. And I did so. I'm not saying it was easy. This kind of healing journey is not easy. The chemotherapy that I was given, that was prescribed for me, was so toxic that I had to actually go inpatient for my chemotherapy treatments because they were giving me something called a rescue drug before, during, and after my treatment. And if you're being treated for longer than 12 hours in a day, you have to be admitted. And so for 4 days a month, for 6 months, this was my thing. And the way that my oncologist did it, he called it a chemo radiation sandwich. And I was like, that sounds disgusting. Can I have the egg salad? Right? Like, because who wants that? But basically, it was 3 months and then a pause and then the radiation and then 3 more months of the chemotherapy. There was also a pause in there between sessions, chemotherapy sessions 2 and 3, so that I could get a power port placed. And if you don't know what a power port is, basically it is a medical device that they surgically implant. Here, there's a baby scar here. They surgically implant so that this is the area that they access for your IVs. And when my oncologist asked me, do you want a power port? I said no, because I didn't know what it was. He didn't explain it to me, and I didn't ask. And I really feel that both of us were assholes for that. Like, both of us should have communicated better in that moment. It would have saved me an awful lot of pain. You may or may not know that when you go through chemotherapy, it blows out your veins. So when I went inpatient for round 2 of chemotherapy, it took an ER nurse 45 minutes to tap my vein. And that was hands down the worst day of my life.